888-959-5057 or go online to WGBY.org. This is WGBY Springfield.
We're taking your questions on end-of-life issues, palliative and hospice care, next on Doctors on Call.
Doctors on Call is brought to you by the members of WGBY and by
Mercy Medical Center is proud to sponsor this program. Mercy is committed to providing you with high-quality care through the use of advanced technology. Mercy Medical Center, improving the experience of healthcare. Learn more at mercycares.com.
Footed Healthcare Store, serving the Pioneer Valley since 1953. Footed's caring staff will help you find the products you need to live your life well. Footed at Memorial Avenue, West Springfield, or online at footed.com.
Hello, welcome to Doctors on Call. I'm Jim Madigan. Every week we are here talking about your health. You can take part in this program. It's an interactive form after all. All you have to do is get in touch with us with your questions. You can call us at 1-800-639-9120, toll free anywhere you are, or you can email us, which is kind of a nice option, provides you a little extra privacy. And the address there is doctors@wgby.org. Our topic this week focuses on end-of-life care and issues. Kind of a difficult, sensitive topic. Here to respond to your questions or comments are Dr. Jeffrey Zesiger. He's a palliative care specialist. He's medical director for the VNA Hospice of Cooley Dickinson. And also with us, Maureen Groden. She's a registered nurse with a special certification in hospice and palliative care. She is the manager of hospice and palliative care for VNA Hospice of Cooley Dickinson. Now, as you call or email, please do remember that our guests can only give you rather general answers to your questions in most cases. Please don't think of this as the kind of specific advice or individual instruction you'd be receiving from a medical professional if you actually saw them in the hospital or the office. If you have any medical problems or concerns, of course, we do urge you to see a physician. At the end of this program, we're going to tell you where you can find a little bit more about tonight's specific topic, so you may want to be ready to take that information down. We're going to direct you to our WGBY website, where there's some information and some links to information about hospice care. With that said, again, phone lines open, emails available, and I know this is for a lot of folks a difficult topic, a sensitive topic, maybe something you haven't thought about, so you may tend to sit back and formulate your questions or your thoughts or something you want to share with us. This half hour goes by really fast, and so often we feel so bad when at the end of the program there are 3 or 4 calls waiting that we just don't have time for, or a couple of emails come in just as the show's ending, and a lot of times they're great questions. So if you've got a thought you want to share, a question you want to ask, now's the time. Get on the line, get on the email with that. To our guests, thank you both for coming in. It's good to have you back.
You're welcome.
Let's talk a little bit about, I think there is some confusion. Big word, palliative, and it's got one of those Latin roots, and you look it up, and the original meaning is to cover something, believe it or not, but to deal with something, to treat something. What do we mean when we say palliative care?
Well, I like your background about the Latin meaning. The covering for me is like a cloak or a hug. So I feel it's a team-based approach. So we come in and just help people with being comfortable and to discuss very carefully what are their goals. Because in medicine, it's very easy to enter a hospital or be in a doctor's office and not feel like you can ask the questions or not say what you want. And we push very hard for all of the team to just talk to people about, are you comfortable? Find out how we can help you be more comfortable, and what are the things that are really important to you in life right now. Because at each time in your life, you have different things that are important, and when you're nearing the end of your life, you have very different things you need.
It is a unique area of care, isn't it, Maureen Groden?
It is, and the folks that have or need palliative care are often really sick, and they're oftentimes getting a lot of treatment. They're often in and out of the hospital. So palliative care offers a team approach, and it focuses on comfort, it focuses on patients and their families, because it's a tough road to navigate when you're that sick and you have a lot of complications along the way. So palliative really helps people, mostly in the last year or two of their life, to manage their illness.
I've got a lot of questions. Before we go any further, though, I do want to mention something that I just learned about. VNA Hospice of Cooley Dickinson, based in Northampton, recently named, and correct me if I get any of this wrong, a Homecare Elite 2010 agency, which really cool in your industry. It means basically that in a survey of, and I'm told there are like 10,000 of these home care, palliative care agencies across the country, means you've been ranked for the quality of your care you provide in the top 25%. And that's in a difficult field, I would think, where sometimes even the best of work may not feel right to somebody. Yeah, and I know, I mean, when somebody's in that stage of life, sometimes it is hard to work with, I'm sure. But you've been recognized, and that's a great thing. We congratulate you.
Thanks for bringing it up. It's a great pat on the back, and the staff really worked very hard. So it's taken years to get people to a place where they can just work in such a good team.
Yeah.
I think the entire agency deserves credit. We've worked very hard to achieve outcomes that are in the top in the country, so we're very proud of that.
The thing that occurs to me is so often in medical care, the regular going to the doctor for the earache, the backache, whatever the problem might be, whatever specialty you're seeing, it tends to be until we get maybe later and we need help or a ride or little kids or whatever, but it's one-on-one. It's the doctor and the patient, the nurse and the patient, nurse practitioner. I would think a lot of times you're dealing with family, patient and caregivers and support group. And you're not treating one person in a lot of cases.
Indeed, and whether you're in the hospital or at home, it's not just that one person's going through such a difficult time, it's that the whole family's going through a difficult time, and they really need help to just support them as much as the patient. So a lot of times we notice that the family's worried more about the patient's worried more about the family, and we just have to get in the same room to say, come on, we're all in this together, how can we help you?
And I would think, again, in your case, your workers are dealing with all sorts of situations.
Right, and we walk right into people's lives, so obviously we're walking into people dealing with not only physical problems, but dealing with financial problems, dealing with emotional reaction to having an illness. So it really is very holistic, and the fact that it's home care also, we really deal with the family and all that goes with their illness, really.
Go ahead, doctor, I'm sorry.
So I'd add in that in our roles, usually you're a doctor, a nurse, but I think in this kind of work, we really all take on a little bit of each other's roles. Because you might be the person that brings up this new idea of, gee, you might be in the last year of your life. You never know who's going to bring something like that up. And if we can all be a little bit social worker, a little bit of a nurse, a little bit of a doctor, health aide, whether we're getting somebody a glass of water or we're talking to them about their medical exam, it's just something that really shows that we care. And then they feel more relaxed, they're more willing to talk to you about the things that matter to them, and then you can find out what they really need.
I know there was an interesting profile done a while ago when you were really moving into this field a couple of years back, the Daily Hampshire Gazette, and I looked back at that again today to prepare for the program. You talked a lot about the fear and anxiety that surrounds, and I guess that's any time we go to the doctor or we're in the hospital. It's an anxious place. I mean, everybody's waiting to get better or waiting to hear what the results would. There's even a different kind of fear and anxiety, I would think, with someone who's gotten those results and it's telling them really what the rest of their life is.
Yeah, anybody that's been ill just knows that all of a sudden one day you're fine, the next day, wow, the rules have changed, your life's changed, and that's just for a simple illness. Even if a friend of mine just came in with appendicitis. All of a sudden his life was totally different. He was worried, would he get through the surgery, had a complication. He's fine now. But to imagine that somebody says to you, you're not going to live much longer. You might have 6 months. We see it from our point of view, and we can help people, but to personally feel that, each person feels it themselves. And you're right, anxiety becomes the big elephant in the room. People talk about what's your blood pressure, what's your heart rate, how bad's your pain, but people really don't talk about their anxiety, and everybody has it.
Yeah, I think that it's really difficult to deal with being told that you have a life-threatening illness, and it affects everyone. And I think that oftentimes people are in different places in their willingness to talk about it. So some people have a hard time talking to their doctor about it. Sometimes family members have a hard time talking to the patients about it. So it makes it really, like Dr. Zesiger said, an elephant in the room. And we find that if we're accepting and able to take people's cues, people will say things like, I'm tired of all of this, or I'm sick of being sick. Mm-hmm. And a lot of times people would say things like, oh, but you're getting better, or things like that, as opposed to just allowing people the opportunity to then talk about what do they want now. Mm-hmm. And I think that that's a key thing. Like you said, sometimes it's the occupational therapist, sometimes it's the physical therapist. So all of us play that role in just helping people to navigate that path.
And some of the things we don't really know when we first meet somebody. Are they going to get better? How much might they get better? Would they be getting ill very quickly, or would it take a while? And it's a moving target. So you meet with people, you share what you know, you find out what they know and what they want, and then you meet with them again the next day, the next week, whatever, and you find things may have changed. And then you have to readjust what their goals are.